Talks on climate change and health and our research project have been going on for several months. Here are some highlights from our town hall meetings held on St. Thomas and St. Croix.
Several minds brought many views to the task of telling Virgin Islanders, be aware and prepare for climate change. Health education and science experts discussed how these changes could affect health and shared their concerns that our healthcare system is already challenged.
The communities that have health disparities are poorer. They have inadequate public health systems, which we also try to address in healthcare reform, both through improving the infrastructure and also investing in creating a stronger public health workforce. The environments that many of our communities live in are already compromised. Many people in our communities work in jobs where heat is already a factor.
It's hard to go and talk to a person about health care sometime and going to see the doctor, and sometime it takes you all day to do a visit to see a physician if you live in a rural community. People have to go to work. They're already poor, so how can they go and see a physician? How can they be involved in the health care system?
What we are most interested in is how do we prevent the onset, or at least delay the onset, and have an arrangement that really focuses on prevention.
We're collecting data, what kind of fish, what size of fish, what their symptoms are, and then we're following them for up to a year after that point to try to get a lot of information, including perhaps a clinical diagnosis for ciguatera and a clinical treatment for ciguatera.
Living with climate-induced changes and understanding you will have to live with them for a while, and taking advantage of any benefits that they might offer. I think that's a wonderful way to approach dealing with this issue that will be with us for our lives and probably our children and grandchildren.
We asked the public how these experts can get the word out to everyday people about the changes to come and make related health precautions.
As a part of the project, Claudette Young-Hines has helped promote the flow of ideas at 2 recent meetings. Claudette, what are some of the public suggestions to get the message out?
Thank you, Pamela. We have listened to the scientists, to residents, and to policymakers, and there are now 4 things that we know. We know that the documented increase in temperature rise has made the dengue virus and the carrier mosquito very happy. The virus is bigger, the mosquito is hungrier, they're biting more, they mature faster. And the warmer temperatures are also very favorable to the culprit in ciguatera. We know that regional cooperation is going to be absolutely important, that there's a need to change public policy, to improve our public health practices, to improve data collection so that it is consistent, it's systematic, in confirming and reporting the incidences of dengue and ciguatera. There's a need to establish and enforce permitting and zoning laws and policies that are going to help to avoid the impact of sea level rise. And it's also important that we support and evaluate the type of actions that government agencies take, community groups take, and that individuals take, because mobilization is the key. It's not simply to be informed. We know that the information has to be targeted to specific groups and that it has to be delivered by the messengers that people listen to, whether it's youth, faith-based groups, environmental groups, community service groups, people for whom English is a second language, and people for whom they are tech savvy, or people that are old school communicators, and the message must always come with recommended actions. And finally, we heard that there's perception that government and neighbors and co-workers don't know enough about this. But if they're given good information, they can mobilize and get ahead of the curve and successfully respond to this new normal. And that new normal is higher year-round temperatures. That new normal are health impacts that go beyond dengue and ciguatera. Thank you.
Thanks, Claudette. Back to you, Winthrop.
If you would like to comment on what you've been learning on this show, please log on to our website, www.whatsclimategottodo.com, or you can call us at 340-693-1336. This program is produced financially for the support by the National Institute of Health with American Investment and Recovery Act's funds. We also want to thank our research partners from the Medical University of South Carolina and the VI Department of Health. Pamela?
That's right, Winthrop. We want to remind our audience that the Climate and Health Study is a 2-year research and public education project for the entire Virgin Islands. Dr. Raxter?
All of us have a part to play in responding to climate change, and we have a shared responsibility. We can change our habits and take action to meet the challenges, and we can start by conserving energy in our homes and our vehicles, by using renewable energy like wind and solar power, and when possible, plant trees, especially native and fruit trees. We also want to remind you that you can protect yourself from dengue and ciguatera by following the guidelines from the Department of Health. I'm sure we can all find ways to be part of the solution.
Well, a special thanks to WTJX for helping us bring the show to life. We also like to thank our esteemed guests for sharing their thoughts. After 60 minutes, we hope you will walk away a bit more knowledgeable about climate change and how it could affect our health. For Dr. Laverne Radster, Pamela Samuels, and myself, Winthrop Maduro, take care of our islands and take care of